Good day. This is Dr. Happy Tom from the Alcohol Free Channel. I'm giving another talk today, and the subject of the talk is the PAR Conference of Alcohol Use. Now that may sound a little funny, but it will become apparent what we're talking about as the talk goes on. I have a quote from the famous German writer Goethe. He says, "Knowing is not enough, we must apply. Willing is not enough, we must do." Maybe that's where Nike got their famous saying from. In the practice of medicine, whenever a new medication or drug is prescribed, the person receiving the prescription should be given informed consent. This is done prior to starting the drug and is called the PAR conference, PAR. PAR stands for Procedure, Alternatives, and Risk. It is more commonly done for a surgery, and that's where I mainly gave it. It was not for medications, although later in my career I did that, but it's commonly done for surgery. But when we pick up our prescriptions now, the pharmacist and his staff include a lot of printed material explaining to the person taking the medication what they're to look for and how the medicine should work. It is not rare for the person taking the medication for the first time to be told that the pharmacist wants to talk to them. I go to Bimart and I hear that occasionally when I start a new medication. It is better to be safe than sorry, and providing adequate information improves the chances of having a good outcome. This video today is about a hypothetical PAR conference for a person buying and using the drug alcohol, especially for the first time. In regards to the procedure, this would be the use of the drug alcohol. Alcohol is clearly a drug. It's not a recreational substance. It's a drug. It has been determined by Dr. David Nutt and some of his colleagues that alcohol is the most dangerous drug in the world. Before someone starts to drink alcohol, they should understand that there are alternatives to drinking alcohol. It sounds silly, but there is water, coffee, tea, and other various non-alcoholic drinks. These are all much safer than alcohol and are more beneficial than alcohol. They do not have the short-term dangers of alcohol or the long-lasting changes in people's health. The modern flourishing of Starbucks points towards the possibility of providing a quality alternative to alcohol. Starbucks sells quality coffee in a welcoming environment for study and fellowship. This is an alternative to pubs, saloons, and other alcoholic habitus. It is not only possible to do this, but as Starbucks has proven, it's also profitable. People seem to enjoy these establishments, but they are not anywhere as popular as the saloon. Many people feel that there are benefits from drinking alcohol. When you are deciding whether or not to do something, like including booze in your life, you will rationally weigh the risk and the benefits. They call this the risk-benefits ratio. We will discuss the supposed benefits of alcohol in a separate episode. The risks of alcohol are myriad. One might say these risks are too many to recount in a single episode. The risks can be broken down into those that are acute, which can happen at any time, and the chronic, which can develop over time. We will start with the acute effects risk of alcohol. Of course, everyone starts out trying to drink responsibly and socially, but drunkenness is an obvious risk. As a person can get drunk, so they can develop hangovers. Both are unhealthy. A really dangerous form of drinking that's very popular nowadays is called binge drinking, where people drink a lot of alcohol fairly quickly, resulting in significant drunkenness. When a person gets drunk, they could suffer a blackout later, where they may not recall part or all of an evening. Bad things can happen to a person when they're in a blackout. The most common risks are drunk driving and injuries. I myself used to be a blackout drinker, and I have lost large segments of my life from drinking alcohol and suffering blackouts. Drunk driving is an obvious acute risk. 10,000 people a year, or 28 people a day, die in drunk driving accidents. Accidents or injuries can occur with plain living, but drinking makes them much more numerous, and the effects of them are much worse. Immoral behavior. This sounds funny in our promiscuous day and age, but immoral behavior is an acute risk that is uncontrolled, and inappropriate relations with the opposite sex may occur, resulting in unwanted side effects. Many families have been started that way. In addition, the following can occur with drunkenness: aggressiveness, lack of control, and impulsiveness. These all increase with drinking. These may lead to many fights. Alcohol is the cause of all sorts of troubles. In movies and in reality, as drinking becomes heavier, chaos and mayhem breaks out. Just think of the last Western movie you watched where they were drinking. Well, what happened? It wasn't pretty. Drunkenness does not cause order and tranquility. Drinking alcohol rarely, if ever, causes peace and picnics to break out. Alcohol causes people to lose control with what is happening to them. They obviously lose self-control, but less well known are the things that can happen to them that are less predictable. There are many acute risks, but the last one that I will mention is alcohol poisoning. Any drinker of alcohol can succumb to poisoning. In the United States of America, 2,300 people die from alcohol poisoning a year. Alcohol can also lower the drug level required to cause death from other drugs. Alcohol, for instance, lowers the toxic dose of benzodiazepine, a very commonly prescribed tranquilizer. Most poisonings involve polypharmacy, and alcohol is the most common drug found in poisonings. The chronic effects of alcohol are numerous, as alcohol quickly permeates every single cell in the body when it is ingested. Alcohol is known to cause damage in every organ of the body, including the skin. Yet alcohol damaging the skin, that sounds kind of funny, but I will discuss this in a later video. The organs most commonly damaged by alcohol that are most widely known are damage to the brain and the liver. There are multiple ways that alcohol causes damage. These are known as the mechanisms of action. I am planning a future video where we will discuss these mechanisms of action, but briefly, they involve changing your DNA, modification of what's called the epigenetic process, how the DNA functions in your body. This is not good when your DNA is both damaged and the way that DNA expresses itself in making proteins, epigenetic processes, is also damaged. There are up to 20,000 proteins manufactured from the cell's DNA. Alcohol damages the body's ability to make these and leads to all sorts of problems. Alcohol is a definite, proven neurotoxin. This means that it causes brain damage. It also causes damage to all parts of the nervous system. It may damage the neurons, the nerve cells, and the glial cells that support these nerve cells. Alcohol has been shown to be involved in brain dysfunction, impaired thinking, impaired memory, impaired coordination, mental illness, and also dementia. There are numerous chronic brain problems associated with alcohol. Alcohol is known to be a causative factor in a profound problem that used to be known as the fetal alcohol syndrome. This was first described in 1973. This is a condition where the pregnant woman drinks alcohol and produces damage in the child's brain and other bodily structures. The response to this alcohol-induced public health disaster has been noted to be a vapid, that's not good, public policy response. This condition is now termed fetal alcohol spectrum disorder, FASD, and is the reason that no women of childbearing age should drink any alcohol ever. The damage that alcohol does to these unfortunate babies occurs in the first 3 months of life. The baby's brain is formed by the 6th week of gestation, and usually the woman doesn't even know she's pregnant. Alcohol causes a spectrum of liver illnesses, including fatty liver, fibrosis, and the well-known cirrhosis. These problems are caused by numerous difficulties initiated by alcohol. A wild one that alcohol causes is the loosening of the tight junctions in the GI tract, allowing the passages of endotoxins. These toxins, endotoxins, are toxins produced by a person's feces or poop. This is bad. You don't want the toxins produced in your colon to get into your bloodstream, but alcohol does that. It changes the microbiome, the environment that the feces is made in, and it allows the toxins to go into the bloodstream. Alcohol can cause liver cancer, known as hepatocellular carcinoma. This is has become one of the most common cancers in the world. And if we keep drinking in the United States like we're currently doing, we're going to have a lot of hepatocellular carcinoma. There are numerous other factors involved in the production of this cancer, but alcohol is a definite player. There are only 2 treatments for these type of alcohol-induced liver problems. Number 1, total abstinence from alcohol. And number 2, liver transplantation for liver cirrhosis after a period of abstinence. If you get hepatocellular carcinoma, there is no treatment for that. You're going to die. Dying from alcohol-induced liver disease is not a pretty process. People will say, well, I will stop right before I start to have problems with my liver. My doctor will keep an eye on me and tell me when it is time to cut down or stop drinking, and I will stop then. Unfortunately, despite your physician's diligence and best intentions, it is usually impossible to determine the ongoing state of a person's liver over time. Lots of people have been told that they have liver problems when they already have cirrhosis of the liver. This is a near end-stage problem that will shorten and lead to a person's death. We still need to have better testing to diagnose the state of the liver in the living. There are numerous alcohol-related chronic health problems, but we are going to lastly discuss the fact that alcohol is a class 1 carcinogen. Less than half of Americans know that alcohol causes cancer. Most of us are aware that there are warnings on a package of cigarettes. I have often wondered how many people read or think about these warnings. When I was smoking, I never read them. I have smoked numerous packages of cigarettes and have never read the warning. I doubt that most smokers have read or understand the warning label on a package of cigarettes. Similar warnings can be applied to drinking alcohol, although the damage to the lung is different, produced by the drug alcohol. Alcohol does damage your lungs. You add alcohol and cigarettes together, you have a toxic combination. Most likely, if I were to ask smokers about the warning label on packages of cigarettes, they might scoff, yeah, the stupid scientists, the damn prudes, are next going to tell us that carrots are dangerous. I can't imagine what they might say about labels that might appear on alcohol containers. Why this negative attitude? Well, I don't know the exact reason for this attitude, but most likely it is due to the thought, that stuff might hurt other people, but it won't happen to me. Informed consent is a lot harder to obtain and is more complex than it appears. However, informed consent is vital as it promotes people's welfare and ensures their rights. Some studies have found that when people are given informed consent about major surgeries, which I used to do, that only about 50% can remember what they were told and recall that they could recall even one risk. That was surprising to me, but believable. However, current studies show improvement in many factors of informed consent as it is improved in many ways. The major problem with alcohol is that our culture has been brainwashed with massive propaganda extolling alcohol in many subtle ways. I have never heard any mention in any media concerning the dangers of alcohol. I have recently heard ads for Alcoholics Anonymous and for recovery treatment facilities on the radio. There is a form of neuroscience-based advertising called neuromarketing. That is in its infancy, but there is no doubt that the manufacturers of cigarettes and alcohol, which together kill over 500,000 Americans a year, desires to maintain control of its massive profits. Alcohol makes over $270 billion a year. This video has been about a thought experiment that I had regarding how to reduce the use of alcohol, how it might be accomplished. The dream was about having a PAR conference, or eventually having warning labels on alcohol containers. I would like to talk to everyone considering or drinking alcohol to think about the things that I've said. The use of cigarettes has declined radically since the first Surgeon General's report on smoking causing cancer in January of 1964. The battle for health has been difficult and slow. I hope that you enjoyed and benefited from this video. Share the video, subscribe, give thumbs up, and please leave a comment. I will return soon with a new video trying to help people see the wisdom of living a healthy life free from alcohol. God bless you and grant you a healthy life living alcohol free.